Hello, good morning, Heather. My name is Kenesha Scott, and I'll be your interviewer this morning. Okay, Heather, tell me about a time in clinical at FTCC in which you delivered high quality patient centered care to individuals, families, and groups, and community in various settings.
During my clinical rotation, I was working on a long-term acute care unit. I was assisting in the care of a patient who had an indwelling Foley catheter. I knew that this Foley catheter put my patient at risk for a catheter-associated urinary tract infection. It was my duty to implement and prevent the patient from a urinary tract infection by providing safe and effective care. With safety being a main priority, I assessed the patient record and reviewed hospital policy with the primary nurse for a Foley catheter to ensure I adhered to the policy when providing care for my patient. I gathered my supplies. By ensuring patient safety, I was able to minimize the probability of my patient developing any urinary tract infections.
Why does this example meet this objective?
My efforts met this objective since they prevented a potential sentinel event by implementing the safety measures to protect my patient from a catheter-associated urinary tract infection. I provided my patient with high-quality, patient-centered care, implementing best practices and adhering to hospital policies.
Tell me how you use something you've learned from one of your class assignments to incorporate best practice commercial or professional procedures that are accepted as prescribed as being correct or most effective, and professional values and standards into compassionate nursing practice.
I was taking care of a patient with advanced COPD. I noticed my patient was anxious. She looked at me and said, "Please help me," as her oxygen saturations were dropping into the low 80s. I immediately notified her primary nurse and respiratory therapist. I knew that I needed to stay with the patient, comfort her, and decrease her anxiety. I instantly thought of breathing techniques such as pursed lip in a calming, reassuring, and therapeutic tone. As a result of my independent nursing interventions, by the time the nurse and respiratory therapist arrived, her oxygen saturations had begun to increase into the 90s. Her anxiety subsided, and she was able to breathe with ease. She admired the care I provided her and strongly emphasized that my compassion for patients is hard to match.
Did the outcome of using this new knowledge improve the outcome of the situation you used it for? Why or why not?
Absolutely. I improved the outcome by recognizing the patient's concerns and reporting them to the appropriate healthcare team members. While waiting for members to arrive, I delivered compassionate care to my patient, decreasing her anxiety, thus decreasing her workload of breathing.
Tell me an example of how you demonstrated cultural and global congruency in the healthcare environment with diverse populations in promotion of healthy lifestyle and preventative health screenings in clinicals at FTCC.
During the COVID-19 vaccination station, I encountered patients that were not able to speak English. I immediately realized that I needed to find an interpreter to communicate between the patients and me. I assisted as she interpreted the pertinent information needed to inform the patients with the type of vaccine they were to receive. This allowed the patients to make an informed decision about whether to receive the vaccine. We then obtained verbal consent. I was able to safely and respectfully administer the COVID-19 vaccination.
How does incorporating this impact how and what you present in patient discharge information and education?
I identified the importance in recognizing diverse populations and the need in formulating a community-based action plan, which ensured health promotion and disease prevention in diverse populations in the community. Upon discharge, I informed them of the side effects and what they need to do in a particular situation. For example, In the event of an adverse reaction such as hives or shortness of breath, they would need to immediately contact their healthcare provider or 911.
Describe a situation in SIM or clinical at FTCC where you function as an effective member of the healthcare team, demonstrating excellent interprofessional collaboration.
During simulation, there was a mass casualty event involving several patients from different stages of life. Collecting the pertinent data provided from the paramedics via my instructor, along with collaborating with my team to prioritize patient care using reverse triage. The patients range in injuries from those who were dead on scene to the walking wounded. Through collaboration, my team was able to tag patients appropriately using the reverse triage method. As a team, we assessed the situation to determine proper medical treatment in the mass casualty event.
What skills have you learned in classes at FTCC have increased your communication skills in SIM and clinical at FTCC?
I used active listening, open communication, mutual respect, and shared decision making in achieving high quality patient care. I also know communication is not only spoken, but is perceived through body language, therapeutic touch, and being present in the moment for those I'm communicating with.
Okay, Heather, describe how you've demonstrated beginning skills in point of care leadership, management, and care coordination using effective communication skills through either successful completion of class projects or a clinical situation or experience.
Under the primary nurse's supervision, I had to determine the dosage of insulin to administer to my patient. I needed to compare the blood glucose levels to the sliding scale in the patient's MAR. I completed the 6 rites of medication administration to safely administer insulin to my patient. I completed and obtained the blood glucose level, assessed the MAR, compared the blood glucose level to the sliding scale, and determined how much insulin to administer. As a result, my patient safely received the appropriate dose of insulin per sliding scale.
How do you plan to grow and strengthen your leadership skills in your practice as a nurse?
That's a great question. I plan to remain non-complacent and continue to acquire knowledge, build communication skills, and remain flexible. I will remain polite and respectful while asserting my voice to advocate for others.
Describe how you implement safe and competent care to individuals through both system effectiveness and individual performance in varied healthcare settings.
During clinicals, I was taking care of a critically ill patient who appeared to be in pain. They were on mechanical ventilation and were not able to verbally communicate their pain. It was my ethical duty to ensure the appropriate pain assessment scale was being utilized when assessing the patient's pain. I used the critical care pain observation tool to assess the pain, which was at an 8. Once I had this knowledge, we were able to administer the pain medication. I reassessed my patient after an hour to ascertain the discomfort level. The patient's pain level decreased to a 6. Critically ill patients, unfortunately, experience a great deal of discomfort, and all we can do is keep them comfortable.
Heather, tell me about a specific clinical situation in which you identified something unsafe for a patient, and what did you do about it, and then why? Would you change what you did then now? If so, why, and what would you do differently?
Yes. I had a patient on fall precautions during a clinical rotation. I informed the patient to use the call bell to let me know if they needed anything. I noticed the patient attempting to get out of bed while performing my hourly safety checks. I hurried into the room, assisted the patient to the restroom, and then returned the patient back to bed. I lowered the bed and ensured I locked it, as well as placing his call bell within reach and putting on the bed alarms. I feel that safety practices have indeed been implemented to reduce the risk of falls and harm.